Introduction to Breztri Aerosphere Inhaler. We're glad you're here. Now that you have your Breztri Aerosphere budesonide glycopyrrolate and formoterol fumarate inhalation aerosol inhaler, and you and your doctor have decided to take the next step to treat your chronic obstructive pulmonary disease, let's talk a little bit about how to use it. In this video, we'll help you to get to know your inhaler by demonstrating how to use it, how to clean it, and how to store it. Please see the full step-by-step instructions you received with your inhaler. Using your inhaler properly and exactly as your doctor directed can help you stay on track with your treatment. Remember, it's not to be used to relieve sudden breathing problems. Don't hesitate to contact your doctor or pharmacist with questions. There are actually a number of different parts to your Breztri inhaler. Let's take a look at them. The middle column of the inhaler is called the actuator. And down here is the mouthpiece. At the top is the canister. That's the part you'll insert into the actuator when you use it. On the very top of the canister is the dose indicator display window. And finally, the cap. This will cover the mouthpiece when you're not using the inhaler. Let's look at the dose indicator display window. This shows you how many puffs of medicine are left. Here's how it works. This whole top part of the canister is where you'll push to use the inhaler. The pointer arrow points to the display window and the dosage number, which shows how many puffs of medicine are left. Every time you press the canister, a puff of medicine is released. Be sure you're only taking the prescribed amount. You can see in the dose indicator display window the numbers telling you the amount of medication available. You'll learn more about that later. Prime your Breztri Aerosphere inhaler. Now that we've seen the parts of the inhaler, let's get ready to prepare the inhaler for use. This is also called priming. Remove your Breztri inhaler from its foil pouch and throw away the foil pouch and drying packet inside. Take the cap off of the mouthpiece. Look inside and make sure there are no objects that will block the flow of the medicine. Hold the inhaler upright, making sure it's pointing away from your face, and shake well. To release a puff of medicine, press the center of the top of the canister until it stops moving. You should hear a little click. That's the dose indicator counting down. Do this 3 more times. Shake, push, click. Shake, push, click. And shake, push, click. It's important you shake it before each priming puff. After priming it 4 times, your inhaler is ready to use. There are times you'll have to re-prime your inhaler. More on that later. Ready to find out how to use your Breztri Aerosphere inhaler? When the inhaler is properly primed and ready to use, the pointer will be pointing to the right of the 120 mark. This ensures you have the correct amount of medicine to start. Please note, if you have a 7-day inhaler, the pointer would be pointing to the right of the 30 mark. It's also good to remember that the dose indicator only moves after 10 puffs and the number in the display window only changes after 20. So once 10 puffs have been delivered, the dose indicator should move to 120. And after you've taken 10 more puffs, the dose indicator should move between 120 and 100. This means there are 110 puffs of medicine left. When there are 20 puffs left, the display window will turn red. That's how you know it's time to call your doctor or pharmacy for a refill. Now, take the cap off the mouthpiece. Then shake the already primed inhaler well. Hold the inhaler with the mouthpiece toward you. Breathe out as fully as you can through your mouth. Next, close your lips around the mouthpiece and tilt your head back, keeping your tongue below the mouthpiece. Inhale deeply and slowly as you press the center of the top of the canister, the same way you did while priming it. When the canister stops moving, you should feel a puff of medicine in your mouth. That means the medication has been delivered and you can release the canister. Remove the mouthpiece from your mouth, but make sure you hold your breath as long as you comfortably can. This can be up to 10 seconds. When you're ready, gently release your breath. That's your first puff. You need to take 2 puffs twice per day so just repeat the process again. After your second puff, put the cap back on the mouthpiece right away. Do not take more than prescribed. Rinse your mouth with water to clean out any remaining medicine. It's important you don't swallow the water. You'll want to store your inhaler in a dry place and keep it at room temperature. It's also important your inhaler stays clean so medicine doesn't build up and block the spray through the mouthpiece. You should clean the inhaler once each week. Let's go over how you should clean your Breztri inhaler. Start by taking the canister out of the actuator, since it doesn't get washed. Don't clean the canister or let it get wet, so be careful with it. Take the cap off the mouthpiece. Run warm water through the actuator for about 30 seconds. Then turn it upside down and rinse for another 30 seconds. Shake off as much water from the actuator as you can. Look through the actuator and mouthpiece to make sure there's no medicine buildup. If there is, don't worry. Just rewash it and shake off as much water as you can. Store the actuator in a dry place with good ventilation so it can air dry overnight. Don't put the canister back into the actuator if it's still wet. It's important to store your inhaler in a place where it's visible so you never forget to use it. In the morning, when the actuator is totally dry, gently put the canister back in the actuator. This may be tricky, but make sure you're not pressing too hard. You want to make sure that it's in, but you don't want to let out a puff of medicine. You should reprime your inhaler after every cleaning, or if you accidentally drop it, or if it's been more than 7 days since you used it. As a reminder, repriming your inhaler is easy. Shake, point away from your face, and press twice to release 2 puffs. For a reminder, return to the How to Prime Your Breztri Inhaler section of the video. And like that, we're done. We hope this has been helpful. Please see the additional important safety information at the end of this video. Make sure you refer to the prescribing information you received with your inhaler or speak with your doctor if you have any other questions. Let's review. There are 3 major steps. 1. Priming your inhaler. 2. Using your inhaler. 3. Cleaning your inhaler. If you need a refresher on any of these sections, just scroll back through the video. Remember, Breztri is not used to relieve sudden breathing problems and will not replace a rescue inhaler. And of course, reach out to your doctor if you have any further questions. Congratulations on taking this step to help manage your COPD. Breztri Aerosphere is a medicine used long-term to treat chronic obstructive pulmonary disease, COPD, including chronic bronchitis, emphysema, or both, for better breathing and fewer flare-ups. Breztri is not used to relieve sudden breathing problems and will not replace a rescue inhaler. Breztri is not for the treatment of asthma. Breztri combines 3 medicines: an inhaled corticosteroid, ICS medicine, budesonide, an anticholinergic medicine, glycopyrrolate, and a long-acting beta-2 adrenergic agonist, LABA medicine, formoterol fumarate. LABA medicines, such as formoterol fumarate, when used alone, can increase the risk of hospitalizations and death from asthma problems. When ICS and LABA are used together, this risk is not significantly increased. Do not use Breztri if you are allergic to budesonide, glycopyrrolate, formoterol fumarate, or any of the ingredients in Breztri. Do not take Breztri with other medicines that contain a long-acting beta-2 adrenergic agonist, LABA, or an anticholinergic for any reason. Tell your healthcare provider about all your medical conditions and about all the medicines you take. Breztri should be taken as 2 puffs, 2 times each day. Do not use Breztri more often than prescribed. Call your healthcare provider or get medical care right away if your breathing problems get worse, if you need to use your rescue inhaler more often than usual, or your rescue inhaler does not work as well to relieve your symptoms. Breztri can cause serious side effects including fungal infection in your mouth or throat, thrush. Rinse your mouth with water without swallowing after using Breztri to help reduce your chance of getting thrush. Pneumonia. People with COPD have a higher chance of getting pneumonia. Call your healthcare provider if you notice an increase in mucus, sputum, production or change in mucus color, fever, chills, increased cough, or increased breathing problems. Weakened immune system and increased chance of getting infections, immunosuppression, reduced adrenal function, adrenal insufficiency. This can happen when you stop taking oral corticosteroid medicines and start inhaled corticosteroid medicine. Sudden breathing problems immediately after inhaling Breztri. If this happens, stop taking Breztri and call your healthcare provider right away. Serious allergic reactions. Call your healthcare provider or get emergency medical care if you get any of the following symptoms: rash, hives, swelling of your face, mouth and tongue, or breathing problems. Effects on your heart such as increased blood pressure, a fast or irregular heartbeat, or chest pain. Effects on your nervous system such as tremor or nervousness, bone thinning or weakness, osteoporosis. Acute narrow-angle glaucoma and cataracts. If you have new or worsening eye or vision problems, call your healthcare provider right away before taking another dose. Urinary retention. If you have new or worsening symptoms or difficulty urinating, stop taking Breztri and call your healthcare provider right away before taking another dose. Changes in laboratory blood values, including high levels of blood sugar, hyperglycemia, and low levels of potassium, hypokalemia. Low levels of potassium may cause symptoms of muscle spasm, muscle weakness, or abnormal heart rhythm. Most common side effects include upper respiratory tract infection, pneumonia, hoarseness, back pain, thrush in your mouth and throat, flu, muscle spasms, urinary tract infection, cough, inflammation of the sinuses, and diarrhea. Please see full prescribing information and patient information and discuss with your doctor.